I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Friends, in andrology, it is important for us to be aware that one topic which touches men in their young, middle age and elderly age group is erectile dysfunction. Friends, erectile dysfunction, a phenomena which is progressive phenomena in many men. Again, in the prime of their life, when they are hoping to be better and they are actually going downhill in their capability of performance, is a phenomena that is sadly a common phenomena which men go through. More so in diabetics, more so in people who have got injuries of spinal canal and various neurological issues, more so in people who are smokers with long-standing changes around, where the end organ, the penis, has no capability of having an erection, which is otherwise a wonderful erection for them to be capable in the bed. So what are we looking at? We're looking at men should get cured. Men are being treated for erectile dysfunction by medical management, by lifestyle changes, by changes in the other aspects which contribute to erectile dysfunction. But it is important for us to also look into those men who suffer from refractory erectile dysfunction. Refractory is a word where the present care and therapy does not work. Their medicines don't work. They've been taking pills towards get better erection. They have got testosterone checked and probably replaced at times. Aspects have been taken care of, but they have not shown result. If somebody is of that kind who has got refractory erectile dysfunction, a dysfunction which is actually making them incapable and difficult, it is important for us to look into that. It necessarily means that we have to look into other aspects also. What are those aspects? Reasons why the erectile dysfunction becomes refractory. That means, is there a vascular phenomena of flow of blood into the penis? Is there a venous incompetence where the blood flows but cannot be retained and the blood flows out, the erection gets lost? Is there neurological phenomena or hormone phenomena where the erection is almost not there or not going to be there? But otherwise the male is fit and he wants to be capable or capable back compared to what he was and then has lost his erections. Friends, today refractory erectile dysfunction having been assessed between the patient and the doctor across the table, it's important for us to take it to a logical conclusion. He's looking at a cure. We are looking at treating and going up the ladder and getting his cure around. And that's where comes something called as penile prosthesis implantation. That means we would look at those patients who have got erection very poor, unable to sustain, not able to perform, not getting erections at all, and who have been poorly diabetic controlled or long-standing smokers and neurological injuries to actually get something called as penile prosthesis. If I look at a picture of a prosthesis or an implant, so that's an implant. This is a malleable implant which actually you can see I can mold it. So this goes inside the penile organ, and as it is implanted inside by a small incision in a very sterile mechanism in the operating room, over the next 45 minutes to 2 hours, the penis gets an erection as a result of a support that is inside the penis. So this is a prosthesis or a replacement of the very aspect of care which is not happening by medicines or there is no capability around. So prosthesis or a penile prosthesis which has got malleability is a more commonly used care for refractory erectile dysfunction across the world. For example, I show you this, that tube phenomena is a very important aspect, and individuals who have got no erections will be implanted two such inside the penis of the size that is required. This comes in 5 different sizes. We look at what girth, what length, what is the implantation, and people start getting better. If you look at various kinds of implants available, and you have an implant which is as worthy as this, gives the erection which is strong enough, or you have an Indian implant called the Shah's prosthesis which has got a great malleability and a great concealability too, can be concealed very well, at the same time has got a great tensile power and axial rigidity, helps us to actually get this. So the entire aspect of care of patients with refractory erectile dysfunction is a good evaluation, good understanding, going up the ladder to the highest level of medical treatment, but thereafter absolutely give him a cure. So for patients who deserve this implant are those individuals who actually have got refractory erectile dysfunction, who have got diabetes of long-standing uncontrolled, who have got cardiovascular events where the neurological phenomena or spinal phenomena has not worked. People who develop priapism and need a complete definitive therapy would require erection because the erection is lost. Sometimes people who have got fracture penis, people with venous incompetence, people who underwent radical prostatectomy in their young age, in their late 40s, 50s and 60s, have unfortunately not had a nerve sparing approach because the tumor was involving the area of the capsule and beyond, will have lesser amount of capability or no erections at all. In such situations, implanting a prosthesis will be like putting a life back to the organ, to the penis, which has lost its life as a result of not able to contract, not able to get the blood inside and relax around. So friends, refractory erectile dysfunction is treatable. Penile prosthesis is a surgery that we do where we implant these two malleable rods which can actually allow you to completely bend and take care of the penis in terms of hiding it, concealing it, being capable and hard, and people do well. Months after months, year after year after year, I continue to do this, and my colleagues in andrology do this in various parts of the country with a lot of understanding and bringing about a right judgment in terms of bringing the expectation to reality. Let's not have fruitless expectations of the penile enlargement because of this. The girth will increase. Those things don't happen. This is a process to make the organ capable to be able to perform sexually as a result of penetrative mechanism getting improved. The mechanism to penetrate is probably missing as a result of the erections not being there. So erectile dysfunction progressing to refractory erectile dysfunction, not getting the medical cure by medical treatment or by vacuum erection devices or by penile injections, are those patients who probably would do well with a one-time curative treatment by a surgical implantation of a penile prosthesis. Important for us to put this awareness to society because people may not know whom to be implanted, where to get implanted and why implanted. For those who don't need an implant, medications do work, but we need to look at a satisfactory complete erectile function in these individuals. So for all men who progressively are losing their erections, it's worth treating them in time with medical management, with lifestyle phenomena, with diabetes control, blood pressure control, hypertension, antihypertensive medications, smoking to be given up completely. And while all this is happening, absolutely important for us to look at erectile dysfunction has an end. It has an end to be treated medically or surgically. And these are surgical treatments where we actually get the care and cure along. So friends, let's wake up to a phenomena that if we are males, if we are in our 30s, 40s to 70s, and we have got erectile dysfunction which is not helping us, it is important for us to get to our andrologist, being assessed, looked at how to take it forward, and finally get the cure by a possible penile prosthesis in the only right individual who deserves this. Thank you so much.